Anatomical and Morphometric Study of Human Skull Base Foramina in Indians, Clinical and Forensic Implications. The present work elucidates the anatomical and morphometric evaluation of human skull base foramina in the Indian population. The investigation was conducted in two different study groups, which consisted of 30 dry skulls and CT scans of 30 adult patients. The observations recorded in these two distinct study groups were discussed in the light of previous respective studies. The study provided information about anatomical variants and dimensions of individual skull base foramina. It became evident that the dimensions of individual foramina displayed a wide range. Statistical analysis was performed to explore any significant difference in the mean dimensions between left and right-sided foramina. The anteroposterior dimension of the jugular foramen exhibited a significant difference between the two sides in dry skulls as well as in CT scans of patients. Besides the individual foramina anatomy, one of the highlights of the current study is the localization of skull base foramina with respect to specific osseous landmarks. The distances between foramina and osseous landmarks also displayed a wide range. The statistical analysis of our results revealed that there was a significant difference between the left and right-sided values of the mean distance of foramen spinosum to infratemporal crest in dry skulls, as well as in CT scans of patients. A detailed review of literature revealed that the assessment of interforaminal measurements of the skull base has been relatively less explored. The results of the current study were analyzed statistically, and it revealed that many of the average values of interforaminal measurements in dry skulls displayed significant differences between left and right sides. It is expected that the results of the present study would be useful for radiologists and neurosurgeons and also serve as an anatomical reference for researchers. Introduction. Understanding the tiny holes, called foramina, in the base of the skull is crucial for doctors, especially anatomists, radiologists, and neurosurgeons. These openings allow nerves and blood vessels to pass through, so their size, shape, and location matter greatly in medical procedures. Studying them also helps trace human evolution. With advanced imaging like MRI and CT scans, doctors can now see these structures more clearly than ever before. However, most research on skull base foramina has focused on Western populations, leaving gaps in knowledge about other groups, including Indians. Additionally, using bone landmarks to map these foramina is rarely discussed in anatomy studies. This study aims to measure and analyze the skull base foramina in the Indian population. By doing so, it will provide valuable data for safer surgeries, better diagnosis, and improved understanding of normal versus abnormal variations. This research could help doctors avoid mistakes when interpreting scans and minimize risks during skull base surgeries. Ultimately, the findings will benefit medical professionals by offering precise anatomical details, aiding in accurate diagnoses, and enhancing surgical safety for Indian patients. Conclusion. The small holes, foramina, at the base of the skull are important pathways for nerves and blood vessels. Doctors, especially neurosurgeons and radiologists, need detailed knowledge of their size, shape, and location to perform safe surgeries and accurate diagnoses. This study examines these skull openings in the Indian population, measuring their dimensions and distances from key bone landmarks. Findings show variations in size and position compared to other populations, possibly due to genetic or regional differences. For example, precise measurements of the foramen ovale help treat facial pain disorders, while the foramen spinosum's location is vital in surgeries involving the middle skull base. Understanding these variations helps doctors avoid mistakes during procedures and imaging. This research provides essential data for safer medical interventions, improving outcomes for Indian patients. By mapping these structures more accurately, surgeons and radiologists can enhance precision in diagnosis and treatment. This important article is authored by the following scientists. Thank you for watching this video. Please subscribe to our channel BP International to watch more videos in the fields of science, technology and medicine.